So good news. Dr. Pacheski called, and she can schedule you for a C-section today if you still want to do that.
So that means the baby's coming today?
Mm-hmm.
Oh, that's incredible. I have to text Howard.
You sure you're okay, sweetie? I know this is a lot.
I'm ready to get it over with, Dad.
All right, well, we'll send you upstairs as soon as a bed becomes available, okay?
And where's Lily at? Lily Cooper?
David, what are you doing here?
Hey, Jesse told me. Are you all right?
You need to leave.
It's okay, Dad. I'm fine, but they say the baby's coming out today.
It's happening now?
You better go, David.
That's right.
I'm ready to take care of you and our baby.
You're telling me this now?
You never answer my calls. All right, I get that you're mad. When you told me I had just lost my job and my mom was sick, and I freaked out, but I got a good job now, all right? They're paying me $12 an hour at that tire and rim place on
too late,
Pulaski.
David.
No, listen. They're giving me full-time hours and...
That's enough. You need to leave.
No, this isn't about
Maybe
you.
I should wait in the lobby?
No, he's the one who's leaving.
Hey, Maggie, call security.
Dad, stop, please!
Don't touch me.
All right, I'm gonna need you wait in the lobby, okay?
But that's my baby.
Not anymore.
Security?
Wait, what does that mean? What does that mean? Lily?
I'm giving the baby up.
Did he talk you into this?
Hey.
Hey, that's my kid. You can't. No, you can't
All right,
just take my
let's-
kid.
let's
Let
go, son.
Give
All
me-
right.
Hey,
Let's go,
I'm
son.
the father. I have a say. Hey, let go. Hey, no, you can't take me from my kid. That's my kid. Let go. You can't do that.
The baby looks good, so we're gonna take you up and get you prepped for the C-section. Are you ready?
I guess.
It's gonna be fine.
Hey, Maggie, will you page OB and tell him we're on our way up?
Copy that.
Thanks.
David,
Don't worry. I'm gonna take care of everything.
what are you doing?
Whoa. David, put that down.
You think I'm gonna let you come in here and steal my kid?
Dad! Dad, no! Dad, stop! Security code silver, active threat in the ED. David, no. David?
Drop your weapon!
No, stop! No, drop it! Drop it! Now!
Listen to the man. Listen to him.
Whoa, I'm a doctor. Let me just take a look.
Okay. Don't move. Don't.
What's happening? Was that a gun?
Stay quiet.
Hey! I said stop moving.
Dad!
Stop moving.
Dad, are you okay? Please don't play Dad!
I'm a doctor. I can help.
Get there. Now. Yeah. Now. Hey, we need to help this man.
Daddy! Dad!
It wasn't my fault. You don't want him to die, do you? No. Help him. Okay. Help. Yeah. Hey! Hey! How do I lock the doors?
You need keys.
Get them! Now! Easy. All right, lock all the doors, now! Hey, they can see me! Hey, they can see right through, they're gonna shoot me! All right. Hey, you! I have to cover the windows. What do I use?
I don't know.
How about the sheets? All right, you have lots of those, right? All right, do it, now. You help him.
Maggie, what's going on?
Nat, fetal heart tones just flipped to the other side.
I just felt something shift. Does that mean the baby's coming out?
The baby just went transverse.
Wait, what does that mean?
Baby's turned sideways in the uterus. She can't deliver like that.
Wait, so what happens now?
We need to move her upstairs.
No, you do it here.
Well, then I need you to get me something out of the Pyxis. A medication, terbutaline.
I'll get it.
Just look at me. Look at me. Breathe. You gonna turn the baby?
The water hasn't broken yet. The terbutaline should soften your uterus.
If she's in labor, we could cause a placental abruption or cord prolapse.
Oh, he's not giving me any other choice.
All right, breathe, breathe, breathe. Hey, look at me. Breathe. That's good.
Dr. Rhodes?
Lily needs your help. I'm not leaving my father.
Connor, I think her uterus ruptured. She needs immediate surgery before she and the baby bleed to death.
I will do the surgery. If you agreed to transfer my father upstairs. No, you fix him here.
I can't. He needs an operating room with a bypass machine.
Operate on Lily, or I will kill you. Right here. You want to kill the only person who can save her?
I will transfer his father, and I give you my word, I will not let SWAT in. Please, David, Lily, and the baby are losing valuable time. David.
Okay. Go.
Keep suction going.
She's bottoming out, Connor.
You said you could stop the bleeding. We had a deal, all right? Your father for Lily.
All right, hold on. I think I got it. Got it. Give me an O proline on a needle.
Pressure's rising.
Bleeding's under control. All right. Let's finish this, and then we'll close the uterus.
See? Lily's okay. They stopped the bleeding, and your baby's here. You can still have a meaningful life with him, David. Please, put the gun down. I promise to help make sure this baby stays a part of your life.
No. I'm taking Lily and my baby, and we're getting out of here.
My baby.
It's a healthy boy.
Hey, Lily, we gotta go right now, all right?
It's not happening.
Hey, she can barely move in her condition.
Stop talking. We gotta go, Lily. We gotta go right now, all right?
David, no.
No, listen, all we gotta do is get to the neighborhood, all right? Because I know people who will help us get out. I promise it's gonna be okay, all right?
No. It's over, David. It's over.
You change your mind. When you do, call my mom. She'll tell you to get in contact with me and the baby.
David.
What are you doing? Give me my son.
I can't do that, David.
Get back, get back. Everyone back against the wall, now. Miss Goodwin, hand him over.
I said I'd help you, David, and I meant that. But I'm not giving you this baby.
I'm not leaving here without my son.
Sharon?
You don't have a choice.
No, you don't have a choice. I will kill everyone in this hospital before I leave my son.
Then you're gonna have to start with me.
Give me my son.
Stay with me, David. Stay with me, David. Stay with me, David.
Target down, hold your fire.
Stay with me. David, stay with me.
Weapons down, let's go! Through the area!
I've
Got Barbara Duncan, Down syndrome, 21 weeks pregnant, passed out and is stable now on 5 liters O2. This is her mother, Kathy.
Hi. Hey, Barbara, I'm Dr. Rhodes. I'm gonna take good care of you, okay?
Okay.
All right. Let's transfer on my count. 1, 2, 3. There we go.
So what happened?
I got dizzy.
She fainted in art class. This is the second time this week.
I have a baby in me.
Congratulations.
I could be a great mom, just like my mom.
I am certain that you will. So I spoke with Barbara's cardiologist. He said that she has a congenital heart defect.
Tetralogy of Fallot. It wasn't that severe, so they decided not to repair it.
Oh, it's possible the extra load from the pregnancy is starting to cause too much strain.
Well, her lungs are wet. So Barbara, we would like to run some tests to figure out what's wrong. Is that okay?
Sure.
Good deal. We will check on you soon.
Doctor, is she gonna need surgery?
It's possible, but we need to wait and see her test results first.
Fine. Just let me know as soon as you can, in case I have to make arrangements or bring in special equipment to the house.
Look, I know that this is all a lot, so is there anybody else that we can call? Maybe the baby's father?
He took off. It's just the two of us. Excuse me.
So, Barbara, your tests are showing that you are in heart failure. And we have every reason to expect that it will get worse as the pregnancy progresses.
How much worse?
It's impossible to say, but the odds of you having a life-threatening event are quite high.
So she needs the surgery.
That would be my recommendation, yes. But you should know, the surgery is long and difficult, and it could pose a risk to the baby.
It's gonna hurt my baby?
It's possible. And unfortunately, if it does, the baby's too small to survive on its own.
He'll die?
He may.
And I don't want a surgery.
Barbie, I don't think they're saying that we have a choice.
Yes, we do.
Honey.
You don't want to take care of this baby.
Barbara.
All you think is gonna be a problem. Like me.
I know this is difficult and painful, but you have to let me handle this.
No! This is my decision!
You're not capable of making this decision.
Look, why don't you two take some time? You can think about it, and we will come back in just a bit.
Excuse me. I have Barbara's medical power of attorney. Do the surgery.
Miss Duncan, I really think that the two of you should discuss
If she
this.
doesn't have this surgery, she could die. Do the surgery.
I'll go put her on the schedule.
No, you won't.
You heard her mother. She has power of attorney.
I heard my patient, and she doesn't want it.
This young woman with Down syndrome is 25.
Yes, she is an adult and does not want the surgery.
Barbara has a life-threatening condition. She needs this procedure.
And what happens if she doesn't get it?
We will put her on medication. We'll have her get weekly checkups from her cardiologist.
And she'll likely still die from heart failure. Barbara's mother has spent her entire life caring for her daughter. Everything she's done, she has done for her. We need to trust her judgment.
We need to let people make their own decisions, not have them made against their will.
I understand your concerns, Dr. Rhodes, but the patient's mother does have legal decision-making power. I don't see any choice but to authorize the surgery.
Thank you.
Barbara, I'm very sorry, but we do have to take you up to surgery now.
No, I don't want to go.
Your breathing is only getting worse. I'm afraid we don't have a choice.
But my baby!
We're gonna do everything that we can to make sure that your baby is safe.
You said you can't. You said my baby might die. Mom, make them stop.
Sweetie, it's gonna be okay.
Dr. Rhodes?
We're taking her up to surgery now.
They're gonna kill my baby.
Sweetie,
It's my baby, Mom! No, I don't want to go! No! No! No!
Ms. Duncan? Sharon Goodwin, Director of Patient Services. I wanted to return your legal documents.
Have you heard anything? Is Barbara okay?
I'm sorry, I don't have any news yet, but could I get someone to bring something for you from the cafeteria, a sandwich or some coffee?
I'm not hungry, thank you.
I'm sure this isn't easy.
If the baby dies, I don't think Barbara will ever forgive me. Do you have children, Miss Goodwin?
I do, 3, but they're all grown.
With Barbara, it's like having a child who never grows up. Don't get me wrong. I wouldn't trade it for the world. It's just the possibility of having another one. It's a lot. I mean, the baby doesn't have Down syndrome. It's not that. It's just... I'm not 30 anymore, and...
You don't feel up to it.
So I keep asking myself when I push so hard for the surgery.
Did you do it for your daughter or yourself? No. Come.
Scalpel and DeBakey's.
Scalpel and DeBakey's.
Marty?
Fetal heart rate is down to 115.
Can you get it back up?
Transfusing her. We're down to 109. 103.
We're going to lose the fetus.
Where are we at on the bypass?
4 liters.
Crank it up to 6.
Wait, what are you doing?
The fetus needs more blood.
Connor, our priority is to save the patient, not the fetus.
We can save both.
If you flood too much blood to Barbara's brain, she could have permanent neurological damage. It could put her into a coma.
Fetal heart rate's down to 86.
Connor, it's too dangerous.
Dr. Rhodes.
That's what Barbara wants. Turn the bypass up to 6.
Dr. Rhodes, just waking up.
Barbie, it's me, Mom. Barbie?
Mom?
Barbara, do you know where you are?
Hospital?
Mm-hmm.
How's my baby?
Why don't we find out? Can you help me out there? All right. And there he is.
Look at him. Look at his little hair. Mom, isn't he cute?
He's beautiful. We're gonna have a beautiful baby.
Mr. Patrick. Hey, I'm Dr. Choi. What brings you in today?
I was looking for Dr. Ethan Choi. Is that you?
Yeah. And why are you looking for me specifically?
Do you recall seeing my wife here a year ago? Megan Patrick?
Sorry, not off the top of my head. Why?
Because you're the doctor that killed her? I don't care what you remember. Just give me the facts.
I understand. But first, I just want you to know that I realize you've been through something truly awful.
Sit down. Just tell me what happened.
Okay, Mr. Patrick. But I have to look up her chart.
Great.
Your wife was given antihistamine steroids and epinephrine, but progressed to cardiac arrest. I performed CPR with ACLS for 35 minutes, but she never regained circulation. And at 9:17, she was pronounced dead. Mr. Patrick, I assure you we did everything we could.
No.
I can only imagine the pain you felt.
She couldn't breathe. Do you know what that's like? I want you to know how it feels. This is your...
Mr. Patrick! There's a toxic spill. Evacuate the ED now!
Code orange! Everyone out right now! Get your patients out right now! Code orange!
Get out! Everybody out! Go, move!
This is Maggie Lockwood. Toxic exposure to ED. I repeat, toxic exposure to ED. Get the hospital on bypass right now. Start the internal disaster protocol. Everyone out now! Move!
Move! Move!
trauma, GCS-9. We just got her, so she needs a full trauma workup when you land.
35% TBSA, second and third degree burns. Take him straight to the burn center. Maggie!
Yeah.
Have you seen Natalie?
Don't worry, I saw her take the patient upstairs before the spill. Dr. Choi? You need to sit down.
I'm okay. But we have more patients in ambulances, so we need to triage into red, yellow, and green and get the sickest ones off in the first wave. Make sure everyone's showered and decon.
You got it.
Come on, straight through here. About to head to the station.
How long till you could detox my ED?
Depends on the floor plan, ventilation, size of spill. I'm sending squad in now.
As soon as they get us the samples, we'll take him down to the lab and try and ID the toxin.
And what about Mr. Patrick?
We're looking into him now, background, employment, family, anything that'll give us a lead.
We already have 12 hospital staff and patients in respiratory distress. We need to figure this out, and fast.
Got it.
Guys, I gotta go.
Ethan, breathe.
Ethan? Talk to me, Ethan. Talk to me.
Get him on O2.
Mask! Here you go.
Ethan!
Ethan.
Hang in there, Ethan.
How's he doing?
Not good.
We'll get him through this.
He was trying to keep me safe. Back there in the ED, that's why he didn't let me in the room.
Yeah.
Please tell me you found something.
Jacob Patrick is an engineer at a textile factory. He has access to numerous industrial toxins. We're hoping to have it narrowed down soon.
Please keep me posted.
I will.
You can't be serious.
Until an ambulance shows up with more, there's nothing we can do.
What's going on?
Ethan and Mr. Patrick are both in bronchospasm and in need of racemic epi. The problem is there's only one dose left.
Which obviously we should give to Ethan.
Who's doing worse?
That's the thing, Mr. Patrick is.
You're not really thinking of giving it to him.
I'm following protocol, April. Whichever patient has the greatest need gets treated first.
He came here on a suicide mission.
I'm sorry.
Give Mr. Patrick the epi.
This is wrong.
All right, the guys inside checked. They can't find any more doses of racemic epi.
We have to do something. His airway's almost closed.
I mean, we could try methylprednisolone. It's not great, but it's better than nothing.
Okay, where can they find it?
And the respiratory therapist cards.
All right, what does that cart look like?
We're wasting time.
April!
Hey, you can't go in there!
Give it to him now.
That was incredibly stupid.
Let's hope this works.
All right, come on. Let's get you decontaminated.
PD's narrowed down the possible toxins. We hope to have an answer soon. Look, I understand you're upset, April.
Ethan is dying. You didn't fight for him.
I did what I was obligated to do. And Dr. Choi would have done the same thing.
Yes, sir. Any changes?
Nothing.
All right, keep him going. Word is we should have an ID on the toxin soon.
He's at VFib. April, start compressions. I need these cuffs off. Monique, stretch at 200. Back.
Clear. Continue compression, charge again. Clear.
Still no pulse.
Charge again. Clear.
Continue compression.
No, he's gone. Time of death, 12:12.
They identified the toxin. It's cyanide.
Oh, God. Ethan.
Okay, let's go, everyone. Let's go. We got the all clear. Let's get everyone inside. All affected staff go to trauma 2 and 3, and we'll triage from there. Let's go.
Give a dose to everyone who's affected.
What is it?
Hydroxycobalamin. It helps counteract the cyanide. I got the hydroxycobalamin. Think it'll work?
As you know, there's no antidote to cyanide. But it's the best chance we got.
We've got a room for him in ICU. We're moving him upstairs. I'll make sure they call if anything changes.
Thank you. Miss Goodwin, you were right. He would have done the same thing. His pressure's going up. I think the medicine's working.
All right, get him upstairs.
Good morning, Mr. Kaminsky. Hi, I'm Dr. Choi, and this is student Dr. McNeil.
Hi.
I understand you're experiencing some palpitations in your chest. How about you unbutton your shirt so I can take a listen?
Sure.
I see we already took your blood pressure.
226 over 117.
That's high, isn't it?
A lot higher than I like to see it, yes. All right, take a deep breath for me. And exhale. Then another. Exhale. Bilateral crackles with mild bronchi.
That didn't sound good.
Not time to panic yet, but it's good you came in. I want to run a few tests and give you something to bring down that blood pressure. Excuse me. Hey, Hank. Start an IV and give 20 labetalol, please.
Absolutely.
Let's get a CBC, CMP, troponins, and set them up with an EKG and renal ultrasound.
Okay.
Hey, Hank. Everything all right? Where you going?
Is he okay?
I'm sure it's nothing. Terry, clean this up and let's get that IV started.
All right.
It's okay. It's okay. It's okay.
Hey. What's going on?
Joy.
Yeah.
I just checked in on Mr. Kaminsky. Nurses still haven't drawn blood or sent him up for scans.
What are they waiting for?
Don't know. Can't get a straight answer. Want me to do it?
No, I'll handle this. Hey, why is nobody filling the orders for my patient in 5?
Got busy.
I need that workup now. Will you do it, please?
Sorry, gotta give stat nitrogen treatment too.
April. Doris, I need you to draw blood in 5.
I'm sorry, I'm on a break. I gotta clock out.
Draw Mr. Kaminsky's blood first, so don't bother clocking back in. Mags.
Yeah.
You gotta rein in your nurses. They're dropping the ball on my patient in 5.
Dr. Choi, we're down a nurse. We'll get to him.
Ow! Ow!
What's wrong?
She's hurting me.
His veins are impossible, and he keeps moving. Stay still.
Ow! Stop stabbing me.
Doris.
There we go. All done.
Suddenly don't know your way around a rolling thing?
That was a hard stick. I gotta run this to the lab.
Mo, talk to me. What happened with Hank today?
Nothing. He wasn't feeling good.
Monique,
We have to ask April.
I'm asking you. We're talking about patient care here. This is serious, all right? Monique.
Your patient's a child molester. He was Hank's piano teacher. He raped him when he was a little boy.
Please tell me this wasn't your idea.
What?
You know how unethical it is denying a patient care. Treat him like a pincushion. I should write you all up for what you've been doing.
Do you know what that guy did to Hank? He molested him, Ethan. Regularly, during their piano lessons.
It's terrible. I know. But it's not up to us to dole out justice. Hank should call PD, press charges.
He did already. But it was Hank's word against Kaminsky's, and the judge dismissed the whole thing before it even went to trial. Yeah. And since Kaminsky wasn't even convicted, he's not registered as a sex offender. For all we know, he's still doing this to other little boys.
Look, I get why this upsets you. It upsets me too. But regardless of how awful this patient might be, we have an ethical obligation to treat him as we would anyone else.
Fine. But there's nothing that says we have to make his stay a vacation. He will get the bare minimum from me.
Look, if that's how you feel, maybe it's better you keep away altogether.
No problem.
Mr. Kaminsky's EKG and scans are done.
Your labs came back negative. I'm not seeing any tumors or lesions.
That's good, right? Can I go home now?
You'll need to follow up with the primary care physician, but it looks like you're responding to the labetalol we gave you, so hopefully we can discharge you soon.
Thank you.
One last thing. I didn't ask you earlier, but hypertension can often be made worse by things like work-related stress.
That wouldn't apply to me because I've always loved my job.
What's that?
I teach piano at my house for over 30 years now.
You have a lot of students?
Enough to keep me occupied.
Pressure drops.
No pulses in V-fib. Perispheric compressions?
Doesn't make any sense. He was fine 5 minutes ago. Say you're staying away from this patient.
He pushed the call button. No one else was around.
Charge 200.
Charged.
Clear.
Still in V-fib.
Push 1 milligram of epi. Charging 200 again.
Charged.
Clear.
He's asystole. I think he's gone. Dr. Choi.
Time of death, 1442.
Not sure what I'm missing here, Dr. Choi. The patient responded to the labetalol, so how do you have a massive cardiac event out of the blue?
I'm not sure.
I know they're pretty rare, but at first I thought maybe a pheochromocytoma was responsible for spiking his BP, but I don't see any tumors on these scans. There must have been some other factor at play, right?
How many doses of epi did we give Kaminsky when he died?
According to the case notes, 1 before he went asystolic. Why?
There's 4 empty amps in the trash.
Really? How could that be?
Follow the body down to the morgue, find Dr. Shore, and ask her if she could tell me how much epinephrine Kaminsky had in his system when he died.
Okay.
And ask her to keep it off the books.
Off the books?
Just do it. I got a preliminary report back from pathology, and there was evidence Paul Kaminsky had high levels of epinephrine in his blood when he died.
So,
I'm not sure he died purely of natural causes, and I need you to help me understand what happened.
understand? What? Are you accusing me of something?
We pushed 1 amp of epi when he coded, right? April, I found 4 empty amps altogether in the trash afterwards. I can't seem to account for the other 3.
Maybe another patient coded in that room right before Kaminsky.
Nothing was locked.
Maybe they forgot to log it. I don't see what this has to do with me.
You were in Kaminsky's room just before he crashed.
You think I killed him?
I'm just trying to understand how so much epinephrine got into his system.
I don't believe this.
April, please, just tell me what you were doing in that room.
He was dehydrated. I gave him a glass of water.
So suddenly you're Florence Nightingale to this guy?
I think we're done.
April, please. Just... You gotta be straight with me. I'm trying to protect you from getting in any trouble here.
Really? Because that's not what it feels like you're trying to do.
Heads up, Joy. We're reviewing the Kaminsky case for tomorrow's M&M.
Okay.
I see you didn't put down a cause of death yet. Something holding that up, or is that just an oversight?
Sorry, I just need to check something first.
I need your John Hancock before the end of the shift.
You'll have it.
Well, if something caused this guy's epinephrine levels to spike, it's going to be on the adrenals, but I'm not seeing anything.
Could you give them a closer look? Something's got to be there, I know it.
I'm not supposed to be doing this without a formal inquiry.
I know. Believe me. You're doing me a huge favor, Nina.
You're going to owe me for this one. All right, let's see. Well, I'll be darned. Huh. Look.
I can't see anything.
There's your culprit. Looks like a pheochromocytoma. It's too small to show up on the scans. Must have been what caused the high levels of epinephrine in this guy's system.
So he died purely of natural causes?
Sure did.
Thank you. You're the best.
What's this?
This is what killed Paul Kaminsky, an adrenal tumor.
Okay.
I am so sorry, April. That was wrong with me.
No kidding.
If I'm being honest with myself, I think I was hurt that he didn't trust me enough to read me in. And then I started to mistrust you as well, and...
Well, maybe I shouldn't have cut you out.
This is Leslie and Ryan Scott, Blair's parents.
I'm Miss Goodwin. This is Dr. Manny.
We were both at work. Heard there was a fire at the apartment, but never expected this. Is she in pain?
No, we've given her medication to make sure she's comfortable.
You've got to save her. We're going to do everything we can for her.
I've reviewed the imaging.
This is Dr. Becker. She's a cardiothoracic surgeon we asked to consult.
One of your daughter's injuries is to her right carotid artery.
What does that mean?
The artery is damaged. It's blocking blood flow. Don't worry, I can repair it while her burns are being excised.
Is Blair going to? No. Blair's burns cover almost 80% of her body. Once her blood pressure is stable enough, we will take her up to the OR to begin excision of her burn tissue. I am afraid she will need to remain in the ICU for several months.
Several months? While the doctors continue to excise and graft her burns.
But then, can she come home?
Yes. However, your daughter's going to need physical and occupational therapy to regain her ability to walk, talk, eat, even dress herself.
No. We understand there are many challenges ahead, but with proper treatment and patience, Blair can recover.
Oh, my baby.
Hi. Good news. An operating room has opened up. We'll be able to take your daughter upstairs for burn surgery.
And repair her carotid artery.
No. Please stop.
No treatments, no surgeries.
What?
We don't want any surgeries.
I don't understand.
But if we don't take Blair up to the OR now, she won't survive.
My wife and I have talked about it. Blair wouldn't want this.
But with proper treatment, she could still have a life.
Look at her. What kind of life?
These last few years have been so hard for Blair. She struggled with body issues, bullying. Just recently, she was able to lose weight, change schools, and she finally felt good about herself. And now this.
She's been through. We can't do this to her.
But people react differently to trauma. You don't know. Surviving this might actually make your daughter more resilient.
You know our little girl.
Mr. and Mrs. Scott.
No. We have to let her go.
Dr. Manning should be clear about the parents' wishes before calling me into consult. It was a waste of my time.
I'm sorry.
They're withholding treatment.
Dr. Manning, I have the consent form.
They're gonna let her die.
I don't think it's that simple. You ready? Mr. and Mrs. Scott, per your request, this form gives the hospital consent to remove Blair from the ventilator. I need you to sign it in my presence.
You sure?
We'll leave you with your daughter.
Dr. Manning,
Yes.
we need you.
Veronica. She's not breathing on her own. Yes. Her oxygen levels are good.
It's been hours.
Her heart rhythm is strong. She's holding on. She wants to live. Little girl, she wants to live. We weren't gonna let her go.
What do we do? How can we help her?
She needs to go to surgery right now. Do it. Help her. Tell the OR we're coming up.
Dr. Choi, Gabby's been short of breath for the last few minutes.
Sats are at 91. April, let's get her on oxygen.
Is there any news?
That's what I came to speak to you about. Please. Gabby's CT did in fact show cirrhosis, and her labs, I'm afraid, are consistent with liver failure.
Oh my God.
What? How could that be?
I have a theory, but I'd like to do a quick exam to confirm. Excuse me. Hey, Gabby. Can you look into the light for me? There. See the golden color around her pupils? Those are called Kaiser-Fleischer rings. They're a sign of Wilson's disease.
What is that?
Well, when our bodies consume copper, our livers get rid of the excess. But with Wilson's, the copper isn't properly eliminated, so it builds up in our vital organs. It's a hereditary disorder. Any family history on either side?
No.
I'm not sure. No.
Can we step outside for a moment?
I'll keep Gabby company.
Thanks. Right now, we're gonna start Gabby on plasmapheresis to remove the copper from her blood. But ultimately, she will need a liver transplant.
Well, can we donate? Is that possible?
Yes, because the liver regenerates, it's possible to donate a segment. We just need a test to see if either of you are a match.
Can friends and family get tested as well?
The wider the net, the better.
Good. We'll reach out to everyone we know.
In the meantime, we'll set you both up to get evaluated. Thank you.
Hey, results are back for Gabby's dad. They couldn't test her mom.
How come? Pre-existing condition?
Lupus.
Dad?
Unfortunately, he's not a match.
John's blood type is AB, Gabby's type O.
He can't be her biological father.
Remember how Jeanette changed her answer when I asked them about their family history?
John probably has no idea.
I'm gonna pull in Dr. Charles.
So if John's not a match and I can't donate, what now?
Miss Phillips, it is not at all our intention to pry into your private affairs, but at the same time, it's important to us to give your daughter the best care possible.
Okay.
In reviewing your and your husband's test results, it became evident that John is not Gabby's biological father.
And we wanted to meet with you in private because we weren't sure that John knew.
No, it's not what you think. Gabby's adopted.
Huh.
Oh, when I asked about your family history, you didn't...
No, we don't want to say anything in front of Gabby. She doesn't know.
Mrs. Phillips, I know it's a stretch, but if we could locate any of Gabby's blood relatives...
That's not possible. Gabby was a ward of the state when we adopted her. Her biological parents were deceased, and she had no other known relatives.
Well, in that case, we'll want to get Gabby onto the transplant list right away.
Thank you. Dr. Charles? Hey, I was wondering, how long does Gabby have to be on the transplant list before she gets a new liver? Please, just level with me.
I'm afraid I can't give you a definitive answer. It can take days, weeks, sometimes, honestly, even years.
Years?
Well, unfortunately, demand vastly outweighs supply. It's why living donor transplantation was developed.
It's not possible for a drug addict to donate, is it?
A drug addict?
Honey, I got you a coffee.
Thank you.
Any word from Paula?
No, she can't.
She's having a seizure. 5 of Ativan IV.
Gabby?
Let's get a brain CT just to make sure there are no bleeds.
Bleeding in the brain? What are you talking?
Just a precaution. Here, let's let them do their job.
John?
Ativan's in.
Dr. Charles, my wife, this whole thing has been really hard on her. She and Gabby haven't spent more than a night apart since the day we adopted her.
Imagine it's incredibly hard on both of you, right? I mean, the stress, emotions gonna run high. We all say things, do things we regret, right? Look, not for nothing, I'm here. You wanna talk about anything? Anything at all?
No. You know what? You make a good point. I should find Jeanette. I owe her an apology.
Any word on Gabby's CT?
It was negative.
Oh, well, that's good. Look, I've been thinking, why don't we see if we can get a look at Gabby's adoption records? Sometimes courts will unseal them in the case of imminent medical need.
But didn't the parents say Gabby's the ward of the state with no surviving relatives?
Yeah, but at this point, I'm pretty sure there's something they're not telling us.
I'll make the call.
Hey, got your page.
Just heard back. We can't get Gabby's adoption records.
Why not?
Because they don't exist.
Okay, so the state made a clerical error. Or they lost our adoption record. I fail to understand how this is our fault.
No one is blaming you.
And what were you doing going behind our backs without our consent in the first place?
Mr. Phillips, please just try to stay calm.
Jeanette, you asked me before if an addict could donate.
Leave my wife alone.
I need you to know that if they're clean now, they very well could.
Really?
I know how much you both love your daughter, but if you're withholding information that could help us save her life, now is absolutely the time to tell us.
We had to do something. We couldn't just leave her there. Gabby was just a baby. She wasn't even a year old. And she'd leave her out in the hallway for hours in this ratty old bassinet. We'd hear her wailing from our apartment.
Who would leave her?
That woman, the mother. She was inside getting high, just strung out on who knows what.
We were just gonna take her up to our apartment for a night, I swear. Give her a bath, get her fed.
Wait, you kidnapped her?
No, it's not like that. We had to save her.
I'm sorry, but you know we have to report this.
We know. Could we have a moment with Gabby to try to explain? Of course.
I'm sorry. I'm sorry. I'm sorry.
It's gonna be okay.
The birth mom, Melissa Thompson, is on her way in. We were able to track her down with the info that Phillips provided.
She clean and sober?
Seems like it. Been working as a hotel maid for the past 6 years.
Good. Hopefully she'll be willing to get tested to be a donor.
Yeah. Nearly had a heart attack when we told her we found her daughter. Mr. and Mrs. Phillips, gonna need you to come with me.
Wait.
We're so sorry, baby.
Oh,
We have no choice.
please. I'm sorry.
Can you do something?
Can you? Please forgive us.
I know this is very scary.
This is all of your fault.
Is that Kylie? She goes by Gabby now.
I can't believe all these years I thought she was dead.
Would you like to meet her?
Yes.
Gabby, I think you have a visitor. Alyssa is here.
Hi. I'm so happy to see you. You are so beautiful.
Get away from me. You're not my mama.
Gabby, I know this is
I want her out of here. I don't care.
I'm not here to hurt you.
Get out. Get out!
I get it. I wouldn't expect her to. But I just thank God that I get a second chance to be in her life in some way. To be some kind of mother.
Thank you for agreeing to get tested.
Anything she needs.
If you follow me, I'll get you started.
Excuse me. The couple that took her, where are they?
They're in police custody.
I was hoping I may be able to thank them. They saved her life.
Thank them, wow.
Motherhood, mysterious, powerful thing. Something you and me never fully understand.
Mr. and Mrs. Harris, I'm student Dr. Curry, and this is Dr. Manning.
And Lisa.
Matt.
So, you're 13 weeks pregnant with 3 days of abdominal pain. Have you ever had pain like this before?
No.
I'm going to examine you. That's all right. Okay, have you had any bleeding?
No.
Okay, any complications with your pregnancy?
No. I mean, not with the pregnancy.
For years, doctors said Lisa could never get pregnant. We tried and we prayed, but nothing worked. Until one day, it just happened.
Did they tell you why you couldn't get pregnant?
Something about the shape of my uterus. They did some tests, but whatever it is, it doesn't matter because we finally have our miracle baby.
So, the thing about human anatomy is that even when things may seem like a miracle, there are...
No, before we get much further, I think we should check your blood and send you over for a Doppler, just to get some more information. Is that okay?
Yeah, it's okay.
Great. We'll be back soon.
First trimester pain in a woman with anatomic abnormalities means that this pregnancy could be ectopic.
Yes, but that does not mean that we need to give her a physiology lesson.
We do if we want her to be informed about her condition.
She's entitled to her beliefs. It is not our job to challenge them.
It is when they're wrong.
Miss Curry, we don't know what we're looking at yet, so just go order the tests.
Is that the baby?
Yes.
What?
Your pregnancy is ectopic, which means that the fetus is implanted outside of your uterus.
Okay, but you can put it back where it belongs, right?
Unfortunately, we can't.
And I'm afraid it's implanted on your vena cava, the large vessel that carries blood back to your heart. And from the free fluid I'm seeing in your abdomen, tells me that unfortunately the vessel is leaking.
So how do you stop it?
You need an operation. The surgeon will have to remove the fetus and then repair the vessel.
Wait, you mean we could lose the baby?
I'm sorry, but you would in any case. Because of where it's implanted, there's no possible way that it'll survive long enough to be viable.
And surgery will keep your bleeding from getting out of control. So we need to get you up to the OR as soon as possible.
No.
I'm sorry?
I am not having surgery.
I don't think you understand. If we don't operate, you're going to die.
No, you don't understand. This baby is a miracle, and God will take care of it.
Your patient, Mrs. Harris, just passed the brief psychiatric rating scale with flying colors.
You actually think she's capable of making this decision?
She is holding on to a very strong belief, but other than that, she seems entirely reasonable.
Reasonable. She thinks God is going to save a fetus with a 0% chance of survival. That's delusional.
In my experience, it's not always so easy to figure out where belief ends and delusion begins. I mean, faith in a supreme being is held by an overwhelming majority of humans.
Okay, but if we don't do something, she's going to die.
Can't force a procedure on her she doesn't want.
We're her doctors. Our job is to fix her, not argue about theology. I'm sorry, but this is ridiculous.
Ms. Curry, I appreciate that this is a complicated situation, but our job, in fact, is to treat our patients to the best of our ability while honoring their cultural, spiritual, and religious beliefs. She's allowed to make her own decisions, whether we agree with them or not. What you got there?
The Journal of Computer Methods and Biomedicine.
MIT grad, right?
Yep.
Looks very technical.
It is, but so is creating a biomolecular scaffolding to replicate human organs in vitro. That's what I'm going to do as soon as I finish med school.
Sounds rewarding. You know, in terms of Mrs. Harris, I just want to clarify that the challenge when you're trying to evaluate a patient's ability to act in their own interests.
Oh, actually, her labs are ready. I should go check on them. She's 90/60.
What's going on?
Let's see. You're losing too much blood. We need to get you to surgery now.
I already told you no.
Honey, maybe we should listen to the doctors.
Not you too, Matt. I am not having surgery.
Lisa,
Please stop. For 12 years, all I wanted was to bring a new life into this world, and finally, God has rewarded my patience, and I don't believe that he would turn around and take it all away.
What if he did take it away?
What?
If the fetus were to stop living because of the blood loss, would you give us permission to do the surgery then, to let us save your life?
What do you... Why is she even talking about this? That's not gonna happen.
She's just asking.
So will you at least agree to that, if the fetus dies?
Well, fine. If that happened, which it won't, then yes, I would have the surgery. We should stop talking about this.
Of course. Bolus a liter of saline and type in crust for 6 and 6 and give her 2 units of uncross matched blood now. We'll be back to check on you shortly, okay?
Okay.
Thank you. Miss Curry, that was a disturbing, tactless question. Why did you ask that?
Because we should know, right? To be prepared?
No, there's a difference between being prepared and terrifying a sick woman. Ultrasound? Start the MTP?
What's happening to
Her
her?
internal bleeding is getting worse. Katie, call the OR.
Lisa!
VP's 92/51. I need to take you to surgery right now.
No, my baby.
Lisa, listen to her.
Mrs. Harris, I need your consent. We don't have a lot of time.
I can't find a heartbeat.
What?
The fetus.
What is it?
There's no heartbeat. Its heart isn't beating.
No.
I'm sorry, but the fetus is no longer alive.
No.
I need to take you to surgery right now.
Lisa, come on, we have to go.
BP 70/35. Mrs. Harris, look at me. I need to take you to surgery right now. If I don't, you will die.
Lisa.
Mrs. Harris, please. Please.
Okay.
All right, let's go.
Hey, I heard Miss Harris agreed to the surgery once she lost the fetal heartbeat.
They got to her in time. She's gonna make it.
Oh, that's a relief.
Yeah, but even though the fetus wasn't viable, its heart was still beating when they opened Lisa up.
Really?
Yeah, I've got to go tell Tech that there was a malfunction with the ultrasound.
Huh.
Have such faith in something and then have it go so wrong.
Yeah. Are you gonna tell her about the fetal heartbeat? I'm happy to.
No, I'll tell her. I just hate to have to tell her at all. I'm so sorry. There was something wrong with the machine.
So I heard about the false reading on the ultrasound.
Yeah, those machines can be delicate. One good hit to the transducer.
Save it. You hacked the machine so that it wouldn't read the fetal heartbeat.
No, I did not.
You've been resistant to the patient's wishes from the start.
Because she was determined to kill herself.
Do you know that I got to be kicked out of medical school?
Kicked out?
Well, you committed a crime.
No, the machine malfunctioned. Okay, I didn't do anything. And by the way, that woman is alive. Doesn't anybody care about that?
That's not the point.
I know what the point is.
Clearly you don't.
I didn't do it.
Well, I can't prove it. Which makes you a very lucky young woman, but you are severely deficient in attitude and temperament, and I'm going to keep a very close eye on you. From now on, you and I are going to go over all your charts and all your cases together.
Are you serious?
Very.
I saw Ethan and Vicky at Gibson's.
So? Ethan's old girlfriend.
Or maybe new girlfriend. I mean, she's beautiful, a doctor, and a naval officer. How do you compete with that?
I'm not competing with that. Ethan can see whoever he wants.
Okay. So you're dating?
That's beside the point.
So you're not?
It's so hard to meet April.
There's been a shooting!
Dennis Mitchell, 28, unrestrained motor vehicle collision.
You're going to Baghdad.
April? April? It's justice!
I'm fine.
Bitches like you just want me to suffer. You're the enemy! It's justice!
Patient is violent and delusional. GCS 15, BP is normal.
I'm gonna kill them all!
Dr. Choi, I need you in Baghdad now.
What about April?
I'll take care of her.
Dr. Charles? Now!
Are you two all right?
Yeah.
Oh, you've been through enough this morning. Go home.
Yeah?
Thank you.
Okay. Monique?
Well, the ED's short now.
We'll manage.
I didn't get a scratch thanks to April. I don't feel right leaving.
Okay, it's up to you.
I'll take care of her.
Okay.
Left arm's deformed, probable humerus fracture.
Dr. Choi?
50 fentanyl for the pain.
He had it coming. It's justice!
Charles, help me out.
5 of haloperidol.
No. They'll learn. They'll all learn!
Breast sounds present bilaterally, multiple lacerations. Looks like a displaced chin implant. Let's get his clothes off. Gonna need x-rays. Displaced pectoral implant. Clear. He's had a lot of plastic surgery. Chest is clear, humerus fracture. Let's get a CBC, BMP, UA tox and order a CT head.
Got it.
Also, liver panel, cardiac enzymes, and EKG.
A liver panel.
Gotta cover all of our bases.
Dr. Choi.
Get that feminoid out of here. You're the enemy!
Okay, I was gonna take him to lockup.
Sorry, Kim's not ready yet.
Bitch!
While he's still here, want to grab a psych eval?
Yeah, knock yourself out, but I'm keeping a police detail on this guy.
Let me know when I can talk to him. Mr. Mitchell, I'm Dr. Charles. This is student Dr. Curry. So, you've had quite a day,
haven't you? I bet you when you woke up this morning, you didn't think you were going to end up here.
Does that feminoid have to be here?
Excuse me?
Feminoid. Void. Tell her to get out.
Okay, you're going to treat Miss Curry with respect, and you don't get to decide who's in this room or who isn't. Do you understand me? Okay, I'm going to ask you a couple of questions because I have to, just to check the boxes. Have you ever been medicated for your thinking?
No.
Have you ever heard voices that other people don't?
No, I do not hear voices.
Okay, so, why don't you tell me what happened this morning?
And Stacy got what she deserved. Bitch wouldn't even have a cup of coffee with me.
Stacy?
They are in control. They have sex whenever they want it. But no matter what I do, they deny me.
Okay.
I deserve love. But they won't give it to me. They only give it to those shallow, stupid alphas.
So, besides being a rabid misogynist, what kind of crazy is he?
Well, he was using certain buzzwords that could be telling. You know, Stacy, feminoid. Makes me wonder if he has an online presence. Could you check that out for me?
Dr. Charles, I am extremely busy.
Oh, okay. Well, in that case, I guess now you're even busier. Maggie.
Yeah.
I'm starting to think that maybe this wasn't a random shooting. Could you look and see if Mr. Mitchell has ever been a patient in this hospital before?
Sure thing.
Thank you.
Monique, did the shooter, Dennis Mitchell, look familiar to you?
I didn't really get a good look at him.
Turns out he was a patient here.
Oh my God. Maggie, I do remember him.
Dr. Charles, Dennis Mitchell was a patient here.
Really?
6 months ago. He came in with an infection after some plastic surgery. Monique was his nurse. She has to be replaced by a male nurse after Mr. Mitchell made a pass at her, insisting they go out.
Okay, thank you.
Dr. Charles, I have the stuff on the shooter that you asked for.
Oh, great. Oh, wait, where are you going? I don't know how to work these. Have a seat.
Hey.
Man, PhD and an MD at the same time? I mean, no wonder you're exhausted. I can only imagine.
Yeah, well, I'm used to working hard.
Yeah, clearly. Show me.
Okay, so, Dennis Mitchell has a history on various message boards. He calls himself an incel, an involuntary celibate. Loser guys who think women are unjustly denying them sex.
Yeah, ironically, the term was coined by a woman. Started a website for lonely people.
This is one of his first entries. I can't attract girls, my legs are skinny, my chest is weak. And he posts pictures. And some guy named Ape Man writes back.
Bro, this is fixable. Pectoral augmentation, calf augmentation.
Yep, and he spends over $10,000 on surgeries. Rhinoplasty, the chin implant, it's unbelievable. He thinks this will make him more desirable.
Yeah, people who don't feel loved will do some crazy things.
Well, it didn't work. This is him a month ago. No matter what I do, women deprive me of my right to sexual pleasure. They're the enemy, and it's time to get even. And he posted this yesterday.
I'm 28 years old and I'm still a virgin. Women treat me like I'm scum. I will slaughter them. I am the true alpha male, and I will make them pay.
It's an epidemic.
What is?
Loneliness. So we watched the last video you posted where you said you wanted revenge.
People should pay for what they did to me.
What they did to you?
I'm sorry, Mr. Mitchell. So obviously you feel like you've been wronged. What I'm curious about is if you're experiencing any regret for what you did today.
Yeah. I have regrets. I wish I'd killed them all.
You're disgusting. You are. You're
Miss
pathetic,
Curry.
You're lonely. Nobody loves you. Poor you. That doesn't give you the right to shoot people except maybe yourself.
What the hell are you doing?
How could you take his side in there? Obviously, you feel like you've been wronged.
I'm not taking his side.
I'm trying to determine if he feels remorse for his actions.
I hate him.
Well, this isn't about you. This is a hospital, and that's a patient who I'm trying to evaluate. A task you just made infinitely more difficult.
No, you were not trying to evaluate him. You just are trying to find some excuse so that he doesn't pay for what he did, so that he doesn't go to prison.
Miss Curry, what he did was terrible. But as abhorrent as we find his actions, our job is to try and understand his mental state.
I don't know what you want from me, all right? I am doing the best that I can.
Hey, Monique, your shift is over. Why don't you go home? Monique?
I am so sorry for what happened. I'm so sorry.
Okay.
I'm so sorry.
Out. Everybody out now. Come on.
It's my fault. It's all my fault.
Your fault?
He could have killed you. If I just had coffee with him.
No. Monique, no. This had nothing to do with you.
How can you even think that?
I told him to leave me alone. I didn't want anything to do with him.
So? Guys should shoot us if we turn them down? Come on.
You do realize how crazy that sounds, don't you? Come here. Is there someone at home that can come and get you?
No.
Maybe a friend?
I don't have any friends.
Yes, you do. Look at us. You do. Yeah, come here.
She needs to see a doctor right away.
Dr. Manning, this is Tanya Griggs, and this is her daughter, Neela.
I don't need to be here. She needs to be here. Look at that bruise on her neck. She came in last night and went straight to bed, didn't even say goodnight. This morning, I found her crying in her room. I tried talking with her, but she won't tell me what happened.
Okay. Hi, Neela. I'm Dr. Manning. Can you tell me how you got these bruises? I was just messing around with some friends. It's really not that big of a deal.
I'm telling you, she's not acting herself.
Mom, please. Maybe you should wait outside.
Okay.
Thank you. Okay, Neela, I'd like to get you changed into a gown. Monique here can help you if you prefer that. I can do it myself. Sure. Monique.
How is she?
Good news is there are no signs of concussion. However, I would like to discuss with you the kinds of injuries I am seeing. The bruises, they're not consistent with having fallen down. Normally we'd find more abrasions and they'd be located more on her joints, like her knee or her elbow. Neela's looked like she was being held down.
Oh my God.
I haven't been able to do a complete pelvic exam, but if I had to guess...
I knew it. I didn't want to think it, but it's true, isn't it?
I do suspect some type of sexual assault. But like I said, without a complete exam...
Baby. Oh, my poor baby.
How many times do I have to tell you nothing happened?
It's okay, Neela. I'm not going to be angry with you. But I need you to tell me the truth.
Why do you think I'm lying? Because she said I was?
Neela. Please. Isn't there an exam you do to determine if an assault happened?
A rape kit, yes. We'd start, Neela, first with a pelvic exam.
No. I don't want anyone to touch me.
Neela, you have to do this exam.
Mom, I said no!
Ms. Griggs, can I talk to you outside for a moment? Just so you know, I can't administer a rape kit against Neela's will.
She's 15. I am her mother. I decide what's best for her.
The exam is very intrusive, and if Neela's unwilling to cooperate, we would need to restrain her.
Can't you just put her to sleep?
I'm sorry, it's not that simple.
I don't care. Whoever did this to my little girl will pay for what he did.
Ms. Griggs, I already told you, I am not going to authorize it without Neela's consent.
Then I want her discharged so I can take her to someone who will.
Okay, then.
You must think I'm some kind of monster.
No. Not at all. I think you are trying to do what's best for your daughter in the midst of a horrible situation.
I was raped when I was Neela's age.
I'm so sorry.
I didn't tell anyone when it happened. Not even my mother. I was so ashamed.
So I'm guessing you never told Neela about this.
Mm.
Don't you think she might be feeling what you felt? Why she's denying what happened? If we are gonna help your daughter, you need to share this with her. Here's the discharge paperwork.
I told Neela the truth. And she told me what really happened. She went to a party, and there was this boy.
It's my fault.
No. No, honey, it's not. And I won't let you think it is. Do you hear me? This boy attacked you. He's the only one responsible. Is it too late to do the exam?
That's for Neela to decide. It's what I want. I'll go get things started.
Keegan and I have been neighbors for a few months since I moved back.
I'm only here because Vicky talked me into it. At this point, I've given up on doctors.
Whoa, no more scratching.
I can't help it. It's been 3 years. 3 years never stops.
And it started with a MRSA infection.
The antibiotics to treat it.
Linezolid. Side effect was pruritus.
Bad itch, huh?
The worst. Everywhere. And I mean everywhere.
But the reaction went away when she stopped taking the pills.
Except for right here, and it is killing me not to scratch it right now.
Itch never lets up. In the shower, when you're sleeping.
Never. I've used toothbrushes, pencils, even steel wool once. Nothing stops the itch.
Easy. Keegan.
Oh.
I know it's hard. Just try not to scratch.
All right, I'm gonna clean it out and apply some steroid cream. Should help calm it down.
That won't do anything. I've tried creams and antihistamines, acupuncture. I've seen dozens of doctors, dermatologists, allergists. Nothing helps. I just can't stop.
Don't. Doesn't that hurt?
All I feel is the itch. It's all day, every day. Please just find it and cut it out.
Okay. Let's get a full set of labs and go from there.
Keegan, I'm Dr. Charles. How you doing?
Of course, the shrink. Look, this isn't because of feelings, and it's not OCD. I don't have delusional parasitosis or conversion disorder. The itching didn't start after my dad died or my boyfriend left me. Look, I'm not insane. My head just itches, and I want it to stop.
Okay. Well, let's try and make that happen.
Really? Usually, docs are writing me a referral, so I'll leave.
Well, you came to us for help, so we're gonna help you. Just for now, though, you think you'd keep your hand away from the wound?
Can't help it.
Okay. So Dr. Joy told me that you've tried OTCs, prescriptions, host of home remedies. How about bupivacaine?
What's that?
A local anesthetic.
5 mil should do it. I'd like to apply a little bit to the area. If it provides relief, it would suggest that the problem might lie in your cutaneous nerve endings, and that would help suggest a treatment plan going forward.
Then stop talking and get to it.
You're gonna feel a pinch.
Do it. Ooh. Okay. It feels different.
Different how?
Better. I mean, it tingles a little, but it itches less.
It's a good start.
Yeah. We'll check on you in a bit.
So anesthetic should provide relief for like 3 or 4 hours. It doesn't come back. Set her up with some topical patches to take home.
Sounds good.
Call Dr. Charles. Keegan, stop. Don't scratch.
Oh, the itch back and it's worse than before.
You have to stop scratching.
Oh, then you have to tie me down.
5 milligrams of diazepam.
On it. I can't live like this anymore. I'd rather be dead.
What happened?
Oh, God. She scratched through to her skull.
That's a new one. Usually I have to cut them open myself to get to the brain.
So what do you think?
Well, for whatever reason, the cutaneous nerves in that part of her scalp went haywire. It makes them always feel itchy, so she keeps scratching.
Better fix?
Yeah, surgery. Sever the nerve. No more feeling, no more itching.
And no more scratching.
Yeah, and possible serious, irreversible side effects. Facial paralysis, blurred vision, worst case, she ends up in a wheelchair.
I'm not cutting her open in an alley, Daniel. The risks you're describing are dwarfed by the reward.
Yeah, we hope.
What do you suggest? Twice a week counseling sessions? Of course, we have to put a cone around her neck to keep her from scratching.
Sam, all those years of scratching, those nerves are shot. There's nothing left to go haywire.
Dr. Charles, if that were the case, Keegan shouldn't feel anything, let alone an itch.
If those nerves were active, that anesthetic would have provided relief for hours. It didn't.
You only used 5 mil. It wasn't enough.
I agree. The anesthetic didn't work for long, but it did work. Proves the nerves are involved.
Great, we have a majority. Not that I care. We done?
Sam, all I'm saying, I don't think operating's gonna do a damn thing.
Thanks for your input, but the last time I checked, I was the neurosurgeon. Put her on the schedule.
Isn't surgery supposed to be the last option?
Dr. Charles, she scratched into her skull. What's all this?
It's an experiment.
For what?
Well, you don't think that Keegan can experience her itch without cutaneous nerves, and I do. I think I can prove it. Have a seat.
Okay.
So, can you take your left arm and put it on the other side of the partition here? Thank you.
So that's like a magic trick?
Yeah, kinda. Okay, so I'm gonna start to brush your real hand and the fake hand simultaneously, but I just want you to look at the fake hand, okay?
Whatever you say.
So, amputees sometimes still feel the missing limb, right?
Yeah, a phantom limb. The nerves are transmitting confusing signals.
Or do amputees still feel missing limbs because the brain is just assuming that it's still there? Because if that were the case, the nerves would be irrelevant, right?
So you're suggesting Keegan's got a phantom itch? Her brain is telling her it's there even though it isn't?
Yeah. Just like amputees perceive a limb that used to be there, Keegan still perceives an itch that she got 3 years ago from a drug reaction, when the brain is basically playing a trick on her.
Interesting theory. Where are you going with all this?
That's not your hand, right? But the more you stare at it, while feeling me brush your real hand, the more your brain might start to blend them together.
I guess I can buy that.
Yeah. Very powerful, the connection between what we see and what we feel.
But Dr. Charles, I still know which one's my arm.
Do you?
For a second there,
You felt the hammer.
Yeah, I did.
Well, and we both know there aren't any nerve endings in this thing, right? Amazing the tricks the brain can play on us.
Keegan, wait! I've changed my mind. I don't think you should have surgery just yet.
Oh, here we go. What crazy ideas Dr. Charles talked you into?
It may not be a nerve problem. It could be a perception problem. In fact, I'm not sure your itch is real.
Not real? Are you too serious?
Look at me. I have to be tied to the bed so I don't scratch a bigger hole in my head. If surgery will work, I have to do it.
But what if it doesn't? What if you wake up and nothing's changed?
It has to work. Because I can't live like this anymore. I want my life back.
Surgery will give it to you. All right, let's go.
Wait, Keegan, wait. The brain can change in response to experience. It's called neuroplasticity. 3 years ago, a drug reaction created a chronic itch that you can't seem to satisfy because it rewired your brain. No surgery is gonna fix that, trust me.
Daniel.
Please, Keegan, let me try something before you go into the knife.
It's been 3 years. What can you do for me that no other doctor has tried?
A trick.
What do I do? I don't know how long I can go without scratching.
Okay, I want you to look at your reflection and scratch the non-itchy side of your head. In the mirror, the image is going to be reversed. It's going to look like you're actually scratching the itchy side.
Oh, I see it. But how is scratching this side of my head gonna make the itch go away on the other side?
Keegan, trust me, we know that you've been feeling this thing, but I just want you to consider the possibility that maybe, just maybe, that this itch isn't real, and no amount of scratching is going to satisfy it.
Well, then what the hell am I doing?
Giving your brain new visual input to override the experience you had 3 years ago so it can begin to rewire itself.
Okay, look, you're losing me.
By feeling yourself scratch one side of your head while you're seeing yourself scratch the other, your brain will be tricked and realize something's not right. Now, hopefully, that experience will force you to perceive a new reality.
A reality in which the itch doesn't exist.
So you say, but nothing's changing. And I feel stupid.
The exercise is designed to confuse your brain, so don't worry about that. Just keep scratching.
Like this? Harder? Softer?
Just like you're doing. Be patient. Give it a chance.
Keegan will be just outside.
You're doing great.
How long are we gonna let her keep scratching?
She's been dealing with this for what, 3 years? I mean, honestly, Ethan, I don't know how long it might take.
If it takes. The phantom itch theory makes sense, but it's still just a theory.
Certainly don't want to give her any false hope.
Dr. Charles, something's definitely happening. The itch, it's less.